I'm Dr. Harikiran, board certified plastic surgeon, cosmetic surgeon and hair transplant surgeon. I'm practicing hair transplant surgery from last 15 years and we have done more than 2000 cases of hair transplant successfully so far. So we have 2000 plus customers who are got transplant with us and happy customers from all over the globe. Today I would like to discuss a very important topic, the cost of the hair transplant. So what factors influence the costing of the hair transplant? Why it is so variable? So when as a patient, I have all these questions. Let's say I'm going to a transplant. So how much is this cost? And why this so much varied? Why it is 1 lakh in some place? Why it is 2 lakhs in some place? Why it is 3 lakhs in place? What actually is making all these differences between from each center to center or each surgeon to surgeon? What is the real reason behind this cost? Today I would like to explain factors by factors what influencing the cost of the transplant. So we'll discuss by one. So before jumping into things, surgeon, when you meet a surgeon, so a surgeon or your doctor, your treating doctor will decide how many, based on your staging of the baldness, they'll decide how many number of grafts you require. By rule of thumb, I'll say simply. So anything above stage 2 usually requires around 1500 to 2000 grafts. A stage 3 requires around 2500 to 3000 grafts. Stage 4 3500 to 4000. Stage 5 4000 grafts plus. So based on the number of grafts, so one of the primary primary thing behind this cost is the number of grafts. So people usually price based on this number of grafts required. Per graft price vary from depends on center, 25 rupees to 60 rupees. Even some centers charge up to 100 rupees. So you need to clearly qualify whom you are going to for the surgery. If it is a qualified surgeon, usually they for the amount of years they spent for the training and the quality assurance and expertise, so they end up charging between 30 rupees to 60 rupees. This is a usual price between the different surgeons. So amateur surgeons usually charge less because they might have a little low experience, so they don't have a confidence, so that they might able to meet your expectations. So they usually put for the lower price. So never fall into the traps for the people advertising 10 rupees per graft, 10 rupees, 15 rupees for 40,000 rupees unlimited grafts. So people never follow that. It always based on your staging of the baldness, which decides the number of grafts. So without seeing it, never go to the unlimited sessions or 300 sessions. Grafts are always decided based on your stage of the baldness only. And second point, as we discussed, it is the expertise of the surgeon, since how many years he is operating these cases and how many of the cases he has done already. Even this can play a crucial role in deciding the cost of the hair transplant. Number 3, people uses various punches. So this is again while extracting the grafts, we use various sizes of punches and various qualities of punches. So when people use simple SS steel punches, they are usually a little less expensive. But when you're trying to take the grafts and to reduce the damage of the surrounding follicles, we surgeons today we started using titanium based punches. They are little expensive. Even this factor influence the cost of the transplant. Again, the fourth factor is where the transplant surgery is performed. Is it a licensed place? Is it a salon? Is it a clinic? So if it is a hospital or licensed clinics, usually the price of the transplant might be little higher, bearing in mind that they need to pay for licensing and other parameters and to maintain the sterile conditions in the hospitals. If the saloons people, if they don't take the adequate sterile precautions, so you'll end up getting infected and possible compromise of losing of grafts, inadequate lighting. All these factors affect the outcome. So it is you need to ensure you are getting under trained surgeon, under aseptic precautions and sterile conditions in a licensed setup. So these are all assure you certain factors to give you probable good outcome. There's a trick called follicle and graft. You need to very clearly understand follicle. Usually a graft can have 2 or 3 follicles. As you know, a single number, it can be a single follicle, it can be 2 follicles, it can be 3 follicles. So they all constitute of one graft. When we talk about grafts, we don't talk about the follicles. So when advertisement comes saying that 10 rupees per follicle, don't consider it is actually true. You need to ask very clearly, is it a graft or follicle? So if you are saying 1,000 grafts roughly, so 1,000 grafts in a man, an average man, usually will have 2,200 to 2,500 follicles. Whereas if you are saying 1,000 follicles, so the actual number of grafts are only 400. So never get a trap of this follicle and grafts. So you need to clearly understand a graft is something we need to ask for. Follicle can vary in number, but grafts are fixed. It could be 1 number graft, it could be 3 follicle number graft, it could be 4 follicle number graft. But the pricing of the graft should be same. So when you are considering follicle, let's say a 4 number of follicle graft, they will charge 4 into 10 or 4 into 20 rupees. So you end up paying more for a follicle than graft. So when it's equal, you need to clearly ask the surgeon or a clinic that how many number of grafts I am getting it. So then things will be very clear. So irrespective of the number of follicles there, you always should be charged with the number of grafts you are getting transplanted. Number 5. So you need to ask what are these costs included. So people might tell you to buy post-op medication, post-op care. Some clinic might offer you PRPs. So all these are all involved in the costing of the transplant. So we should clearly ask the surgeon or the clinic whether are you getting the post-op medication and maybe post-op PRPs if required. So these things, whether they are included or not, even this could influence the cost of the hair transplant. So I want to repeat what we discussed today. 1, the expertise of the surgeon. 2, number of grafts you are receiving based on your grading of baldness. 3, it is a qualified setup or a qualified hospital or salon. 4, it is the quality of punches they are using, the materials they are using. Number 5 is whether it is a grafts or follicles. 6, whether the post-op care is involved in the package or the PRPs are charged separately. These 6 factors, if you can know, usually you will able to justify the price you are paying. Usually with the qualified surgeons, apart from GST billing, anywhere but 30 rupees to 60 rupees based on the location and setup, based on the expertise, it is reasonable. So this is my sincere advice for the people who are actually looking for the cost of a hair transplant. Hope this information gives you and throw a light on the hidden areas what most of the clinics or people who are commercial don't talk about. So I want to make a clarity and clarify all the doubts. If you have any more questions, please write the comments and I would like to answer the most of the questions. Thank you so much.